Okay, let's begin. Hello, friends. I am Dr. Vivek Bhartiya, Vice President in IGMA and also Chief Medical Officer at Arogya Mandir, Raipur. It's my privilege to welcome each one of you for today's workshop. We all are here with one purpose: to learn, to grow, to transform through naturopathy. Today's session is designed to be interactive, practical, and life changing. Those who have dreamed to be in cruise business post completion of their BNYS, then the biggest tool they need to have is acupuncture. And today we are having this session on acupuncture by a very experienced doctor from our fraternity. So, what you will take in today's session, you will take some simple, powerful, and natural methods that you can start with applying from right from tomorrow when you move to your practice. So, participate, ask, experience, transform. Today, we are privileged to have with us Dr. H.K. Gurudatta sir. He is a brother to me. He is a senior naturopath, a highly experienced physician in yoga and naturopathic medicine with almost 3 decades of experience. He is founder of Anandamaya Wellness Center, Bengaluru, and currently he is also a senior consultant at Shamavena, that is, it's a naturopathy hospital by SDM Institute of Naturopathy and Yogic Sciences. He is a gem of person. He is expert in traditional Chinese medicine, acupuncture, acupressure, and has successfully treated many chronic pain and musculoskeletal disorders, neurological conditions, autoimmune and metabolic disorders. And of course, he is also a stress and lifestyle expert. He has guided CEOs, celebrities, and global clients with evidence based naturopathy healing. His approaches focus on personalized yoga therapy, lifestyle correction, and emotional wellness. We are blessed to uh, learn from his vast knowledge and clinical excellence today. Thank you, everyone, for joining. Let us begin this powerful journey towards a healthier, happier, and a more energetic life, and that too naturally. If you want to ask questions, you can ask at the end. So, with said so, I introduce our today's speaker. We have a message in the message box. Dr. Vikas Kaushik, he has messaged to us that he is currently intern at Shamavena. And thank you, Dr. Vikas, for acknowledging this. And we welcome you for today's session. So we have the gem of the speaker with us. With that, I share the mic to him. And even if good morning, sir. Dr. HK.
Morning, Dr. Vivek. I hope I'm audible and it is very clear.
Yes, sir.
Uh, am I audible?
Yes, sir.
I'm sure
Yeah.
it's all clear, right?
Yeah.
Let me increase the volume. Yes. Thank you so much for such a nice introduction. I'm really privileged to be in front of all these people. And it's a lot of energy when youth come in, It's an inspiration for us also to teach and share our knowledge. And it is very fulfilling and satisfying for me to interact with such a nice audience. Let me not waste much time. I'll share my experience and what is required for us today to expand our horizon of BNYS practitioners across the country and the world. In case if there is some disturbance, please let me know, Dr. Vivek.
Yes,
I'll,
sir. Sure,
yeah.
sir.
I would like to share my PPT. Could I? Uh, I'm not. Yeah.
You
Shall
are
I
able?
share?
Yes, sir.
Yeah. I'm. Yes. Yes. I'll share my PPT now. Just a second. Yes. How many of us think acupuncture is important? I would say acupuncture is one of the most important tool in BNYS and naturopathy practice in India. Another important tool for us is yoga. If these two tools are well integrated with the principles of naturopathy, today we can probably conquer the whole world, because our course is the only course in the world which has all these subjects in one under one roof, recognized by a university, given the registration in respective states in the country, even though we are still struggling to get our national registration, which is in process, I'm sure, which will end up in a good, positive way, as our co uh, practitioners and colleagues are working hard to get that going. I graduated in 96, that I don't know what to do after my graduation. But today, that is not the condition. People are looking for you guys, looking for genuine practitioners. Let me warn you that in today, we have so much of uh, non-medical practitioners. I don't want to call them quacks though, but non-medical practitioners are so high, especially in acupuncture. Not to say naturopathy as well, even naturopathy as well, we have to fight those things. But at the same time, how can you make yourself unique and qualified and registered is only professionalism and our medical knowledge. It's not just the medical knowledge, we should also have the intuition. It's very important to have the intuition, experience, knowledge base, and integrate all these things and give a very nice tea for our patients, where they have a solution for most of their health issues. So that's how I would view into it. Today, let me jump to understand how naturopathy is in lines with acupuncture principles. Any of the questions, let us take it in the last. I want this session to be interactive. It should be helpful for you guys. And at the same time, I'll be very happy with many questions to come in. That way, it will help my, uh, experience as well. uh, India, I heard in one of the conferences that there is one Ayurvedic doctor whom I know, even though at a distance, that naturopathy is the origin for all the other systems of medicine. Even though we can tell that it has come from the West or Europe, whatever it is, our history talks about it, but naturopathy is innate, a healing system of medicine for the whole human race. It has come from nature. From the nature itself, Ayurveda has also been developed. So this practitioner, Ayurvedic, very senior practitioner, always mentions that, sir, naturopathy is the root for Ayurveda as well. Let us imbibe that within ourselves in our practice. Let us not feel that we're inferior to anybody. Actually, we are superior to most of them. It is just that we have to present ourselves in the right way. So it is one of the healing systems in India, for the whole world, where we integrate body, breath, mind, emotions, intellect all together in tune with our nature. So yoga and naturopathy can form the foundation for all the health aspects, not just health, also disease management, disease dealing, and curing it as well when detected early. And at the same time, it is not just that. We can also work on so many aspects. The diversity which is there in yoga and naturopathy, no other system of medicine would have, I believe. Because you can become an acupuncturist, you can become a yoga therapist or yoga physician, You can become a nutrition expert. You can become a wellness expert. You can become a trainer. You can be a doctor. You can be a family physician. You see what is the array of things what you have in front of your plate. It is just your interest, what kind of which tool to use, which one is very passionate for you to take it up and make sure that you deliver it to the community. That way, it forms a very basic foundation for health for every human being on the planet Earth. So we know our horizon, our reach is throughout the globe. And many of our practitioners have already shown by spreading themselves across the world, irrespective of their get the recognition from the government for regulation or whatsoever it is, in different names, in different headings, we are across the world today. And acupuncture also shares a very similar philosophy, even though it is from China. I heard one of my very good friend, when he visited to China to learn acupuncture, you know what the first thing they told as soon as he entered into the class, the concerned department and professor told, it seems, I've heard him directly from him, that we thank India for giving acupuncture to us. That means historically, there are some records, even though it is not highlighted or understood or known, that acupuncture is also from India itself. There was a movie also a few years back in Tamil about, I forgot the name of it. So, which tells that Dharma, somebody who traveled all the way from Tamil Nadu to China, and that's how the acupuncture or traditional Chinese medicine originated or shared or evolved. So, obviously, it is from nature. It's from nature's principles. So naturopathic principles, yoga principles, acupuncture, TCM, they're all integrated. They're all coming from the same root, even though different branches. Let us try to understand these things little more, scientifically, and how we can put it into action in our practice. What we call it as chi, let us try to bridge that between our prana and the vital force, what we talk in naturopathy. It's all the same. So it is just that we'll talk in a different language to understand the same thing. A TCM practitioner talks it as about chi, a naturopath talks as a vital force, but a yoga practitioner talks it as speaks in the language of prana. So, but it's all the same. That we need to understand very clearly. And this, for us to understand, and when we understand, we can share with our patients and make them understand. Today, the most important aspect what we need to know is we have to get convinced and be convicted to these concepts so that you can translate and spend time with your patients to make them understand and also show practically how it works. Then they are there with you for lifetime for their health issues. Um, Let me go to the next one. In acupuncture, we talk about health is homeostasis. How does this homeostasis happen? I hope most of the practitioners are already completed BNYs. That's what I understand. There could be some interns, PGs, and students as well. Across everybody, I'm trying to talk about this so that it reaches everyone. And I hope they all understand about these aspects. What we talk about chi, or uh, uh, the energy in acupuncture, is through which runs through all the meridians, which we all know. There are about 12 meridians plus two extra meridians. Plus, there are 8 extraordinary meridians, which we probably don't learn in our college, but they are equally important. They're interconnecting the main meridians, which are very, very helpful and required. And in terms of TCM and acupuncture, as we all know, a balanced flow of chi across through all the meridians is health, and illness is all because of imbalances. I categorize this imbalance in 3 aspects. One is either there could be stagnation or excess or deficient. It's just that we need the tools to understand this, either through blood test or your investigations or through different traditional diagnostic methods. It could be naturopathic diagnosis or TCM based diagnosis, whichsoever it is. Everything falls under these three categories: stagnation, excess, or deficiency. The most easiest to treat is excess and stagnation. Deficiencies where you have to boost because of various reasons, it is not so easy, but we can always help them. Even naturopathy believes on the same aspect, right? So naturopathy believes on the aspect of that you can heal within yourself. The body has the exact capacity or optimal capacity which can heal any imbalances when given an opportunity and environment. How does that happen? Maybe through fasting, through yoga, through nutrition, hydrotherapy, all these tools, what we have, massages, food aspect. These are all the things which we can use at home, and some things which we have to treat in our centers, naturopathic centers, which will help to bring in a state of homeostasis, whether it is chi or prana or through meridians, it's all the same, using natural elements, including diet and lifestyle. So you can understand there is so much of uh, uh, parallels between naturopathy and acupuncture. That's why acupuncture fits very well in naturopathy. Let me tell you, only in India, acupuncture is part of naturopathy. Nowhere else in the world they add acupuncture. They talk about acupuncturist, but in India we call as naturopathy doctor who practices acupuncture. And we need to keep on holding on to this, and we should not let go of this. It's a very important tool for us, and we can make a big difference, as I mentioned. In terms of parallels, if we have to draw, as I have mentioned in the PPT, you can understand chi is nothing but prana, meridians are nothing but nadis, what we call it as, whether it is Ayurveda or yoga. Yin and Yang, which is the basis for acupuncture, is nothing but Ida and Pingala balance in terms of yoga. So you have such a wonderful tool to balance yin and yang through acupuncture, acupressure, even meridian massage. With the massages, what we do could also be through working on the pathway of the meridians. Once you identify there is an imbalance in that meridian, whether it is excess, whether it is deficient, or you have to boost it, or you have to reduce the excess, or even release the stagnation. So that is how you can work with different tools what we have. You can use oils, which will help. You can use aromatic oils, which will help further. There are some practitioners who practice aroma puncture as well. Dip the needle in the aromatic oil and put on the meridian and the acupoints, which makes a lot of difference. But only thing is, for all these things, we need proper, a recording of the observations, what you do, documentation, and prove that it is helpful, and studies, case presentations. This is what we lack many a times. If we can bring that into action, then it becomes mainstream medicine. So we can understand whether it is yoga, acupuncture, naturopathy, they all emphasize on homeostasis, both at physical level, Annamaya Kosha, energy level, Pranamaya Kosha, Manomaya Kosha with our emotions, and intellect, Vijnanamaya Kosha. Thereby, you can reach a state of Anandamaya Kosha, which we talk about in yoga, which is possible only when these four different layers from the base becomes integrated, synced, so that we reach a state of Anandamaya. In terms of science, let us try to understand what happens when we put a needle. A lot of patients ask, what happens, doc, when you put a needle in the body? I'm curious to understand. I'm sure you all know about all these aspects. I'll just brush through it, not go very deep into it, because I want to touch more on traditional aspect than anything else. Um, As we all understand, this is something very important. There is one center in Europe called evidence-based acupuncture. They have LinkedIn, they have Instagram, Facebook. Please subscribe to it. They have given a lot of protocols based on scientific research studies of different ailments, right from anxiety, allergies, pain management, you name it. And they're doing wonderful job, and we need to, probably some of us have to get in touch with us and integrate with them and show what we could do. So they all talk about this. When a needle is inserted into a specific meridian or a acupoint, which is nothing but neurovascular junctions in the fascia or the connective tissue, there are a lot of serotonin, happy hormones, endorphins, which gets released. That is the key for us for all the healing to happen. And you understand that today a lot of emphasis is given on that than anything else. Functional medicine talks about the same thing to get into that aspect. I consider functional medicine is old wine in new bottle. It's all about naturopathy and yoga with a scientific background, evidence based. That's what we need to do today. So I would rather say they have hijacked us. Actually, we should have taken that place. But anyway, it is not too late. With a good team of occupants, DNYS fraternity, we can take them over. Not only that, I've also noticed that the parasympathetic activity when you do acupuncture heightens, which happens same whether you are going for a run, as Dr. Vivek does a lot of Zumba, dance, integrated with his practice. The same way in yoga, acupuncture also does the same thing. So now you can understand the parallels how much we have. Parasympathetic activity increasing makes a lot of difference. Yesterday, I had a podcast with one of my teachers. She's in Canada. She's a TCM practitioner of acupuncture. She's called Clara Cohen. She's a wonderful teacher, wonderfully presents TCM-based acupuncture across the globe. So when we were having the podcast, we had a discussion about this parasympathetic activity, autonomic balance to hypothalamic pituitary and adrenal axis regulation. Today, because of lot of stress, we all have adrenal fatigue. Even though that is not in ICD, it is not yet probably part of ICD yet. But adrenal fatigue, which is something which is taken over the world across, it is not yet completely having a protocol to diagnose, but I feel that is something which happens, which leads to lot of other problems, leading to low-grade inflammation. And that low-grade inflammation leads to all the diseases, right from cancer, heart disease, diabetes, autoimmune condition, arthritis, you name it. Even for that matter, uh, autoimmune, lowered immunity, leading to frequent infections. I would consider everything starts from low grade inflammation. How low grade inflammation can be managed? It can be managed through yoga and naturopathy and acupuncture without any medication, absolutely in a great manner. So that is what I would understand. And that is the tool, strong tool, what we have with us. Not only that, along with that, when a needle is inserted, the microcirculation in the local area improves a lot. I had seen a video about that. Someone had done a microscopic analysis. What happens when you insert a needle? So before inserting the needle, under a microscope, your tissue is observed, a sample of a tissue. And once the needle is put into that tissue, automatically in the microscope, I could see that through a study, through a video, that the blood cell, the flow suddenly improves. So that is the microcirculation which helps and which improves, leading to managing our low-grade inflammation to a large extent. Not just that, immune modulation is also very, very active, which will help in autoimmune conditions when you do acupuncture. Let us not restrict acupuncture only for pain management. I want to look beyond that. IBS can be helped, gastritis can be helped, arthritis could be helped, migraine could be helped, neurological deficits like Parkinson's, early stage Parkinson's. It's wonderful, it will help. Alzheimer's, neurodegenerative conditions, allergies, you name, we have so many things to conditions which can be addressed with acupuncture through these means by a release of happy hormones, by regulation of our autonomic nervous system, and local improved circulation with immune modulation. This is how acupuncture has a very scientific basis. I would say acupuncture based on TCM has more studies across the world than yoga and naturopathy or anything else. So you can imagine the acceptance of TCM based acupuncture across the world is so high that people understand, they go for it. So it's not it we are just sitting on the tip of the iceberg in India. And today, NIMHANS has done studies, AIMS has done studies, CCRYN is supporting studies for all conditions where acupuncture could be helpful in pain, anxiety, and all the lifestyle disorders. We should make use of that. We should release research, publish more and more papers. So this is the basis for scientific aspect in terms of acupuncture. Um, Let me go to the next. The most basic concept, I think most of you would understand this, yin and yang. Uh, Yin and yang is the most basic concept in yoga, sorry, acupuncture, I'm sorry, in acupuncture. I hope you are able to see. Should I start in? Yeah, this is better. Yes. I don't want to go into depth of this because you would all know about this already from the text. I would only try to explain this how I explain to a patient. What is yin, what is yang? If you tell them that this is female, that is male, that is day, that is night, how do you correlate it? It's very difficult to correlate it. I would just say this. Yin is like uh, potential energy. Yang is like dynamic energy or kinetic energy. A simple analogy is if you have a flame or a lamp burning, what happens? The flame is yang. The oil, which is able to burn the flame, is yin, potential energy. So how does this work? So without oil, there cannot be yang, and yang is also required for yin to be nourished. Yang is all the dynamic functions, metabolism, what we have. Only when they function, automatically they nourish the yin. When the yin is being well nourished, then automatically you will feel that the fatigue, all those aspects which are there, which is caused by indeficiency, is balanced. So interaction between yin and yang and a balance between them is homeostasis. Only thing is we need to understand how to diagnose this, whether yin is excess, yin is deficient, yang is excess, yang is deficient. Let us discuss in another session exclusively only when yin and yang could be taught, how to diagnose, how to identify in terms of pulse, in terms of symptoms, in terms of tongue diagnosis, the imbalances between yin and yang, and what points could be used to balance that. That is how we can understand. So let us, what is the basic thing is, we have to understand that this is a, sorry, let me go back. Let me not finish this ad. We need to understand that it's very important for us to understand yin and yang balance is homeostasis. Yeah. And you might be knowing what all organs are related to yin: liver, heart, spleen, lung, kidneys, and yang is related to gallbladder, small intestine, stomach, large intestine, and urinary bladder. So when we are talking to a patient, let us try to understand which organ is affected, whether it is yin is affected, yeah, yang is affected. I'll give you an example a little later to understand this little more better. But I'll try to cover up only this basic, superficial concepts of TCM-based understanding for acupuncture. So this is the first thing we have to do to understand yin or yang, excess, deficiency, or either of them. Which one is most important? I would always tell, if you consider this yin, yang, the balance is health. Sometimes this goes up. yang is going up. Assume that yang is going up. Yin is normal. So what happens is yang excess. This is yang excess. Yang is heat. So there is a lot of warmth, inflammation, tendency towards inflammation is very high. Anger, all those things are very high. So you will have heat symptoms. But at times, when what happens is yin can be deficient as well. Yang is normal, but this is yin is deficient. I hope you're able to see this. So what happens? This we call it as empty heat. When yang goes up high, this is full heat because only heat, yang is high. That's why full heat. But yang is normal, but yin is deficient. So that is empty heat. But still you have empty symptoms. I mean, sorry, heat symptoms, but it is empty heat. So what you're supposed to treat is increase the yin, not reduce the yang. But when excess heat is there, yang is up, then you have to work on reducing the yang. That is how we clinically understand this. And at the same time, sometimes yin can be low or yin can be excess. Then it is cold symptoms, full cold. But at the same time, when yang is normal, yin is deficient, that is empty cold, deficient. So you'll have to work on boosting the yin. But when yin is excess, you have to bring down. So cold symptoms. So empty heat or full heat, empty cold or full cold. This is how we have to understand in clinical aspect to work on those aspects. We'll have to correlate that with different conditions of ailments to make sure it is. Hypothyroidism is mostly cold, indeficiency. So how to identify that? Through pulse, through tongue, we'll have to identify. We'll come to that little later. That is the concept of yin and yang. Next, the meridian system. You all know about it. I don't need to talk too much about it. Uh, all the meridians are connected to each other. Let us understand this. Liver is connected to gallbladder. So it is a network of meridians, network of energy channels through which the chi flows, and where there is an imbalance that causes the issues. Each organ is representing a emotion, and it has its own functions and its dysfunctions as well. So we need to understand not just the meridians. Meridians are understood for the points where which one to use. You learn in acupuncture through your colleges, Z cleft points, Leo connecting points, all those points. They're all points to reach the meridian in such a way that you balance that out. But before that, my teacher, Clara Cohen, has always mentioned, who her teacher was also mentioned to her in TCM, no treatment can go wrong. It's what can go wrong is only diagnosis. Diagnosis is the most important thing we should understand, that very much required for us to give the right treatment. So spend a lot of time in diagnosis. Understand which meridian is excess, deficient, or stagnated. For example, an injury. I have just hit my knee somewhere while walking. So what happens? You automatically take your hand to support that. It's the kind of you press wherever you have pain or something. So I explain this to the patients that when you press that automatically, because there is stagnation, inflammation. So you release that inflammation, you release that stagnation, automatically it feels better. That's how I would connect with patients to help them out to understand these concepts. So you all understand this already, so I don't want to go into details of it. This whole network is connected to organs and thereby the tissues. Meridians is not just main meridians. There are sub meridians and sinews, which are superficial in the skin, which will connect to the meridians. It is like channels, the main plumbing channel, sub channels, and then the tap. So you have the tap on the skin, then it goes to the next level of meridian, which will sub meridians, which will have an impact on the main meridians, which will connect to the organ. That's how the network works. There are a lot of practitioners across the globe who work a lot about meridians and meridian massages as well. It is not so well taken here and understood much, but meridian massages are also equally important to balance that out. And I have seen that when you work on spleen meridian, they feel, Doctor, I felt so nice. It was such a nice release for me. So that's how it works. Next most important aspect in TCM is 5 elements. Please understand the basis for most of the diagnosis for us comes from 5 elements. Yin and Yang, 5 elements is the most important aspect we need to understand for diagnosing and understanding the problem. Imagine a case of hypothyroidism or diabetes, for example. I would tell diabetes and hypothyroidism is a metabolic disorder, as we all know. What are the what is the function of metabolism? What is the idea of this our thyroxine and our digestive system? It's basically conversion of energy from one form to another form, whereby we are nourished to sustain our life. So digestion is so important. Digestion, when we say, it includes elimination as well, right? But mostly it is also to do with absorption, assimilation, digesting, and getting the nourishment. It is nothing but earth element. Earth is our mother earth, is always nourishing. So stomach and spleen is linked to that. So earth element is connected to stomach and spleen. So in most of the diabetes cases, you may understand, I would see their tongue, pulse, and symptoms, and understand their digestive capacity, and understand that this is spleen chi deficiency. It could be for various reasons, but the root is spleen chi deficiency. It could come from um, fire, or it could be from metal, which is drawing too much excess from the earth element, or it could be because of liver overacting on the spleen or wood overacting on the earth. Either of those things. So this mother-son relationship, and sometimes you have to go to grandmother as well. Grandmother means earth's mother is fire, fire's mother is wood. So wood is the grandmother of earth. So we have to understand which organs are related to which element, and how that gets imbalanced, what symptoms they do have when the imbalance is there, when balance is there, and what points I could use. So this dynamic interrelationship is very, very important for us. So always try to understand the root cause and which organ it is affected, which element it is affected, what emotions are connected. First thing I would ask today, a thyroid or a metabolic syndrome case comes, I would ask, do you tend to overthink? Oh, yes. Then the patient tells, how do you know, doctor? Yes, because you have this condition, overthinking, worrying, brooding, makes the spleen energy deficient, spleen chi deficiency, stomach deficiency. When that deficiency is there, automatically what happens? It will lead to all the other issues. So if you don't address that root cause of overthinking or worrying or not letting go, you're doing the job half done, right? So that's the reason we have yoga, we have massage, we have meditation, so many other tools which will help to work on that as well. Aromatherapy also will help for us. Head massage will help you relax, thereby work on overthinking and these emotional aspects. So that's how we have to connect all these aspects. Lung, someone had, one of the patients 2 days back in Chennai, I was consulting. He has lot of skin allergy, I believe. I understand it is skin allergy and respiratory issues, chronic cough. So uh, the lung meridian or metal element is connected with the emotion of sadness and grief. So I just asked, sir, do you have had any sadness or grief episode which you have not processed in the last few years? Then he told, yes, doc, how do you know that? I don't want to understand what is happening with you, but if you will willing to share, you can share. Otherwise, it's all right. You won't believe he started crying. Doc, how did you understand I had this? I told that is the cause for your cough. Please process it. Consult a psychologist or a counselor, or you want to talk to somebody, whether it is your spouse or a friend or a parent, whosoever it is, please talk. Then what happens with that is you will be able to process your emotion, relieve your sadness. I, I'm pretty sure in about 3 months, if you can do this along with acupuncture, your cough will come down. It's very chronic cough to the extent that you can lose consciousness. He will become unconscious when he has the cough. To that extent, he has the issue. Then I started my prescription on the lung meridian, then checked on his tongue. Oh, the lung area where it represents. Is there some issue? Then I could see there is a small swelling around the lung area in the tongue. Then check the pulse, lung meridian point, wherever it is. Then you will be able to identify there is a excess or deficient in that part of the pulse. So then that's how we can automatically understand and connect with the patient and give an appropriate solution through all the tools what we have in naturopathy and yoga. These are few examples. We have to actually dwell much more deeper. A separate session has to be done. Vivek, we can plan some time later in some time as we go along. A session only for in India, a session only for five elements, then the meridian system. Then it makes a lot of impact and understanding. Let us jump to the next one. The next important aspect which I talk about is our circadian rhythm or organ clock. See, organ clock and circadian rhythm, as doctors, we should understand we are part of nature. We are not apart from nature. So when we are talking about that aspect, how sun rises, sun sets, how the weather changes, everything impacts us. It's not that actually we are impacting the nature and making a lot of global warming and leading to a lot of issues. So I always talk to my patients, what time you sleep, how much time you need to get sleep, what time you wake up, how is your routine, what time you eat. So all these things affects our circadian rhythm. When circadian rhythm is uh, disrupted, automatically there is an issue with our metabolism. Metabolism leading to inflammation. Inflammation leading to several other diseases. Along with that, the stresses which come into picture. So automatically what will happen? You end up in diseases. You tell me today who doesn't have fatty liver? In a 100 people, if you scan along, I believe at least about 5 to 6 would have fatty liver today. Hypothyroidism 20 years back was understood only as goiter, not much more than that. But today, every home has one patient of diabetes, one patient of hypothyroidism, someone else hypertension, and fatty liver, though, is underlying for everybody. Why? Because of our lifestyle habits that's setting it apart. Most of us, what time do we sleep? We talk about it, how much we do it. So I advise all my patients, please sleep by 10 o'clock. We tend to become nocturnal these days, sleeping at 12, 1, 2 o'clock, waking up late. So this disrupts our circadian rhythm and the energies in terms of all the five elements and meridians and thereby the organs. See how well our ancient system talks about. You sleep, but what time? Just a simple example here. You sleep by 10 o'clock. You finish your dinner by 6:30 or 7. That is the time where you have to make sure you finish your digestion in such a way that by 6:30 or 7 you finish your dinner, you sleep by 10 o'clock, your most of the digestion is complete. Thereby, you are resting well. You don't have too much happening in your digestive system, which helps for detoxifying where liver and gallbladder comes into action in terms of TCM from 11 to 3 a.m. But if you are awake at that time, it is causing a problem. It doesn't detox yourself automatically. Then what happens is the consolidation of memory, the detoxification is supposed to happen, doesn't happen. That will lead to a lot of health issues. Even though it is a gradual process to happen over a period of time, it definitely happens. And you have to wake up at Brahmi Muhurta, we talk about in naturopathy, Ayurveda, yoga, everything. That's between 3:30 to 5. See the lung time. And 5 to 7 is the large intestine when we have to empty the bowels. 7 to 9 is the time for our stomach start secreting our juices, is the time for our breakfast. 9 to 11 is thinking, how you plan the day, you start working and making it happen. And 12 to 2 is the right time for us to have lunch. When the fire is high, juices are maximum secreted. And if you eat at the right time of that time, then automatically digestion is much better, assimilation absorption is much better. Then again, 3 to 5 is the time to finish your work, and 5:30 is the time to retire. Unfortunately, these days it doesn't happen for various reasons, whether it is rural or urban. Rural is way better in that sense. Then comes the rest, the cycle continues. This is how we can help all the organs to sync and work together, all the five elements. And in terms of modern medicine, also, keeping your organ clock, circadian rhythm in balance reduces the inflammation, thereby preventing a lot of conditions. This is also very, very important for us to make, to understand for ourselves. I'm not going into the details of this, but overlook is what I'm trying to cover up. So when we talk to our patients, this is how we have to inculcate the habit of importance of circadian rhythm and organ clock. I have a picture of this and I show it to all my patients. So these are the basic concepts of TCM, what we need to understand. And how do we diagnose all these things? It's very, very important that, sorry, we'll come to this little later. Uh, Four important aspects of diagnosis. Yeah. We have to identify the disharmony in yin and yang, the first most important thing, or chi and the blood and the organs. If we understand these five elements, circadian rhythm, body clock, the symptomatology through the history, then we can understand the imbalances, whether it is yin is excess or yang is excess or deficient. Chi is excess or deficient. Blood is excess or deficient, and which organs it is affecting. Thereby, we'll have to understand those imbalances to plan our treatment protocol. So these are the four things which you'll have to always work upon when identifying or diagnosing in TCM, traditional Chinese medicine. You could use modern medicine or investigations as well to understand this. It could be a blood test, it could be an X-ray or an MRI to understand all these aspects. We have to correlate all those things. That, as a doctor of naturopathy and yoga, it is our responsibility to make sure these two things are bridged well. The concepts of yin and yang, chi, blood, and organs. The first four most important pillars in diagnosis for traditional Chinese medicine is inspection, as we do in our modern diagnosis, auscultation, palpation, and inquiry. Inquiry, root case taking, very, very important. Based on different organs, different emotions, you take a detailed history. You inspect sometimes through different means, either it is pulse by auscultation and palpation, uh, or through inspection by seeing, viewing whether there is swelling or a cyanosis, or inspection of your eyes, how they open, the areas around the eyes, facial diagnosis in terms of different organs representing the if I have a migraine, which side, which temporal, parietal, frontal, occipital. So different organs or with different meridians which are connected to that, we need to understand. For example, it's temporal, then gallbladder meridian. So gallbladder is the offshoot of liver. So is there an imbalance in that? So that's how we try to understand and make things happen, right? So that's how inspection becomes important. Then auscultation. As a doctor, it's mandatory for you to make that happen. Inquiry is just nothing but case taking. Palpation. You can palpate and check out. An important tool to understand in palpation TCM is when I press a particular meridian or acupoint, if the patient feels, oh, it feels so nice, doc, please do it. That means there is deficiency. Your energy is getting transferred to that person. That's why he feels nice. If it is excess, it will, no, 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 don't touch me. that part, please don't touch me. That means there is stagnation and excess. That's how palpation also can be understood. Then comes the tongue and the pulse diagnosis. We'll delve into that in much more detail in the next couple of slides. And then, based on these three important things, the patterns or disharmony in yin yang, chi blood organs, and the diagnostic methods, and the pulse diagnosis, tongue diagnosis, we come to identifying a pattern. We call that as beyond Zeng in TCM, in the sense what pattern they are into. It's very, very important to understand whether it's spleen chi deficiency or liver yang excess or stomach heat or chi deficiency, blood stagnation. What is happening? These are different patterns which we have to identify. Only when the pattern is identified, then you select the points and the treatment. Whether hip bath is good or mud pack is good, or which part of the body has to be used for mud pack, it depends on that. So pattern identification is a very important tool and a skill to learn. Even I have not excelled in it. It needs a lot of practice and understanding to get into that pattern identification. We call that as eight. Uh, I, someday, I forgot that phrase. Next class about that aspect because I also have to deal with it much more in detail. So that's how traditional Chinese medicine diagnosis happens. Then comes the tongue diagnosis. Different organs are represented in our tongue. Four important things: the tongue. We have to identify the shape of the tongue, color, and then the spirit or the vitality or the luster, and the thickness of the tongue. Based on that, we identify which organ is affected based on the map which I have shown: the heart, lungs, stomach, spleen, liver, gallbladder, kidney, bladder, intestines, everything we have to identify. We have to look for teeth marks or strawberry prickles, which are all red spots which are there, or which is inherited as birthmark, or it's a development. All those things, coating of the tongue, color of the four important things, as I mentioned: color, coating of the tongue, and then the thickness of the tongue, and finally the spirit or the luster or the shine of the tongue. All these different things are identified in tongue diagnosis to identify which organ is affected and which emotion is contributing to that. That is about tongue diagnosis. I think we should have a separate class for that. Then comes the pulse diagnosis. Pulse diagnosis is a very, very important tool. As you can see in the picture, you need to understand, use your three fingers to keep it three different places, left and right, which is called as Qi Guan Kun, which tells about kidney, stomach and spleen, on the right side, lung on the right, heart and liver on the left. So you hold the position and try to understand whether it is thready, whether it is excess, it is wiry or deficient. It's not just about the rate of the pulse, but these three things are important. Not just three things, it is superficial, middle, and deep as also equally important. Pulse diagnosis is a skill by itself. I've not excelled it, but there are people who can see the pulse and tell the whole aspect of your history of health without even inquiring. That is the beauty of pulse. But only drawback with pulse is it is based on your emotions as well, your physical activity and emotions. That's why it's very difficult to identify. I I'm not excelled it. I probably intuitionally I'm not very much good at pulse diagnosis, that I cannot tell. But this is equally important for us to understand. Pulse diagnosis by itself is a big chapter to discuss about. So a inquiry, as I mentioned about in this slide, and then the tongue, and then the pulse gives the exact pattern what we have to identify. See, a few examples for us to understand this is in terms of tongue, some patterns which I was talking about in a couple of slides before. So let us try to understand. For example, if you have a red tongue, the color of the tongue is red. It's yellow coating and wiry rapid pulse, which means to say that red is inflammation color, fire because red, yellow coating is damp or heat, what we call in traditional Chinese medicine, and the pulse is rapid and wiry. In the sense, like when you feel the pulse, you can feel that it is so fast, and at the same time, it feels like a wire. So that means to say, based on the symptoms, you can tell it's liver fire. Am I audible?
Yes, sir, you are audible.
Oh, sorry, I suddenly got disconnected. I'm sorry. I'll share back. Yeah. So in the same way, another example is pale tongue, weak, ready. It is the pulse is weak. It is not going very well. So pale, we understand lack of blood, anemia. So blood deficiency. So we have
Please wait. There must be some disconnection issue. So, sir will be joining us back soon. Yeah, I think sir has joined again.
yeah, my internet connection. There should be some issue. I'm sorry about that. Yeah. Am I audible?
Yes, sir.
Okay, done. Vivek, I'm just left with maybe another few minutes. After that, I can take questions.
Yes.
Uh, so that way, pale tongue tells about anemia or blood deficiency. Another aspect is a thick white coating. The pulse is very slippery. Thickness of the tongue increases. It's nothing but damp or phlegm or kapha, what we talk about. It could be fat or fluid accumulation, whatsoever it could be. So that's how we identify different patterns through the tongue and then select the points and the treatments accordingly to give a holistic solution through all the tools what we have in naturopathy and yoga. So this how we can integrate our practice traditionally with the modern medicine to identify the different aspects of the patients what we talk about of their ailments and their conditions. Now I think as a gist you could understand how helpful we could be for our patients, how we can help them in different areas to help regain health and live a healthy, happy life. So, this is the beauty of yoga and naturopathy and acupuncture for us. What is the need of the hour today? All this is governed for us from NIN, CCRY, state universities. We also have MD in acupuncture from Chennai MGR University and also from Bhopal. We have the university. But what is lacking today is little bit of standardization to international standards and a national regulation what we require. I understand West Bengal and Maharashtra also already have acupuncture councils. Who is forming this? Who are non-medical practitioners? When you have an intervention like acupuncture entering into your body, there are a lot of complications which could happen. There could be anaphylactic reaction, which can lead to death sometimes. Recently, there was a case in Kerala a few months back. A pregnant lady died after taking acupuncture. So the modern medicine doctors will be scared whom to refer to. I don't know. I can't refer to some quack, right? Non-medical practitioners. I have to refer to somebody who knows about the body, who has the medical knowledge. So we are the right people for that. So we have to strive as a community to get this going so that we go in the right direction. I remember few years back, few decades back, homeopathy was taught through books, through online or through books, and they started practicing homeopathy because they work mostly on symptoms, no diagnosis. But eventually, as BHMS came into function and many colleges came, regulation came into picture, all those things vanished. So what is required for us in naturopathy is our community has to grow to a critical mass. When is critical mass comes into picture, automatically things will start flowing. So we need more and more people coming and practicing so that we represent, then patients and the public understand yoga and naturopathy means we have to go to a doctor who has qualified with BNYS. You don't need to go to anybody in a nook and corner of the street, right? That's why it is important to get national regulation. Then integration of anatomy, physiology, traditional philosophies in our practice. We are the right people to do that, and we are responsibility to do that. So potential, what we have today and challenges we have spoken. One of the important challenges is lack of sufficient research, funding for that, and doubting about our own system, skepticism, and regulation laws. But this could be always integrated. I think even Apollo Hospital in Chennai, I'm sorry, Delhi has acupuncture department. So we have to reach out and explain to them and talk to the language of allopaths to integrate ourselves with them, which is slowly happening, but we need to take it much more forward to become part and parcel. For example, in West, infertility clinics have acupuncture department. We need to get that in India. We are the right people to do that. There are a lot of infertility gynecological cases when detected early. Acupuncture and naturopathy yoga can do wonders to help them out. PCOS, for example, fertility issues, male or female, how well we can help for all those things. We are the very good, stage to make them help them. Then research. The future is for basically research with different disciplines, and at the same time documentation. Whatever in my patient history, I document every day. Today, this is the observation I did with the treatment. Tomorrow, when they come back again, what was the progress? So this was the progress. This symptom did not do well. So I make a note of that and what points have to change, how we have to change. Just like allopaths, how they do. You come after 15 days after your medication, what happens, let us see, and then plan accordingly. Same way, documentation with standardized protocols internationally is very, very important for us, not just giving treatments. Because that documentation tomorrow will help for generations to come. By doing this, this can happen. And you publish the knowledge. It is not just practicing with your intuition and knowledge, but spreading it across how generations together can carry on for human race to be in a good state in years to come and decades to come. So we need to focus on that as well. So the vision for India is this for me. Basically, healing should be united with tradition and modernity, both intuition and investigation should go together. India is having the cusp to bridge this science and spirituality for holistic health. And uh, we need to understand prana, chi, nadi, meridian is a continuous process. And the prevention, harmony with nature, personalization of treatments should be our goal. Every individual is unique as we understand. So their treatment, their conditions are also unique. We have to plan according to that. That's why you, as a doctor of naturopathy and yoga, your responsibility is personalization, working on focus on preventing the condition and being in harmony with nature is most important. I hope I've covered quite a few things. Thanks a lot for the patient hearing what you guys have been doing. I'm really obliged. It's a pleasure for me to share my experience and knowledge. Now I'm open for the questions. Thank you so much for taking the time and sparing your time. Yes, um, Dr. Vivek, I'm done. If anyone has any questions, we can go through it.
First of all, thank you so much, sir, for such a wonderful presentation. We got a great insight of everything. You were so precise about everything. We could understand it properly. And one of
Thank
uh,
you.
the presentation where you were telling about the different organs working time, especially through that clock one, that is really a great understanding. I think that will help us how to actually keep the diet pattern along with the treatment while you are treating the patients. So I think that is one of the great asset they should carry with them. Let's
Yes.
go ahead with question and answers now. So we are open to the question and answers. So we have a one question from Dr. Archana Agrawal. How to differentiate
Yes.
the cold and full cold by giving an example with symptom presentation in patient. Um, sir.
Yeah. Yeah. See, generally cold symptoms, if it is empty cold, in the sense like yang is excess, or yin is deficient being full cold. It's like you're feeling very cold, you're having a lot of dampness, fatigue, all those aspects are very prominently seen. You may be having swelling as well because there is no movement because the cold, blood and chi movement is reduced. Then you can feel the cold extremities. You can have swelling, and they feel warmth is required. I need warm environment or heat, thereby my symptoms reduce. That is full cold. Empty cold is the same symptoms, but at the same time in a much lesser intensity. So that's how a empty cold and full cold is understood. Not just with symptoms, we also need to understand with our tongue and the pulse. I'm not so good at pulse though, but tongue, yes. Cold is seen as, uh, you know, thickness of the tongue increases. The coating will be little bit of white and thick, which is dampness, which is also cold sometimes. So that's how those two things can be identified. Actually, Dr. Vivek, we should have one class in future only about this one concept. Clinically, how do we understand this? This is a overlook overall I have given, but we can delve in deeper aspects in future as well.
Sure, sir.
I hope to have answered that question.
Yes, sir. So we have another question from Dr. Vikas Kaushik, who is already intern at your hospital. What skills
Uh,
did the BNYS intern develop to gain confidence in acupuncture practice?
the most important for acupuncture practices, I had a challenge always when I'm pricking a point for a patient, I am hurting. So that is there in most of the students, I understand. We have to overcome that. How do I overcome? Let me prick myself first and understand. And choosing the right point, the speed of insertion is very, very important. Identification of the point, speed of insertion. The patient should not even feel that you've inserted the needle. To that extent, the skill has to be developed. And that can happen only with practice. You have to keep practicing on self or friends or peers, whosoever it is. Then when you learn it, skill develops automatically as we go along. So when you do this, and along with that, every day an intern, what all cases he sees, he has to go back and refer back in the books, ask the seniors, and understand, correlate. Then automatically you'll gain confidence. Sorry. And when you see, for example, the patient becoming better with the symptoms, confidence grows. Automatically confidence grows. That's how we need to understand that and improve our skills. It's only practice.
Thank you, sir. Another question we have from Aruna, Dr. Aruna D. Uh,
Yeah.
Student or doctor. Sir, please suggest potential clinical acupuncture courses to pursue after BNYS, if at all we have to do it.
Um, as such, I would always recommend any kind of course you want to do after BNYS in acupuncture, look for university regulated one. Please don't go for any practitioner teaching, whether it is me also. It doesn't, it's very important for us to get a university recognition. It can be an MD from MGR University or Bhopal, or today you have a lot of potential to go out of the country and pursue. There is one very good university in US called Yosan University. They have MD programs. The curriculum is excellent as long as you could afford to do it and spend that time, maybe 2 years or 3 years. And I'm telling you, if you do that, you get recognition across the world. Not that BNYS is not recognized, but that's an additional feature where you can be proud, prominent, and on the top of the subject. So we have the internet today to explore. Vietnam has very good courses. China has very good courses. UK they have British Acupuncture Council. So Arizon, this one is so big enough that we can look forward for that. I always suggest Yosan University. I try to get in, but my practice and my commitments not allowing me to go there. But they also have an online course for 1 year or 2 years, MD in acupuncture. We tried for that, but they did not take us in. Maybe a lot of our people, when they start mailing or sending the details of what we have learned, they may accept it. So we need a critical number for that to happen. So ultimately, they're also wanting to run the university in terms of finance. At the same time, they would accept as well.
Thank you, sir. So we have another question. Sir, please suggest good book to refer for TCM.
My Bible for TCM is an author by name Giovanni Masiosia. He's an Italian actually, settled in US, but he's no more now. But he studied TCM from China, and the way he has translated the traditional Chinese TCM-based books is excellent. Search for online Giovanni Masiosia. He has a website as well. Churchill Livingstone Stone are the publishers of his books. Their books are expensive, but it is too deep to refer to and understand. Several conditions have been given. There was a separate book on meridian, separate book on pulse diagnosis, separate book on basics. 8 or 9 books are there. Separate book on mental illness and TCM, obstetrics and gynecology, you name it. It's excellent.
Thank you, sir. Sir, can you please write in the chat box about the name of the book so that they can.
Yeah. Okay.
So, Spurti ji, so you can refer this book. Yes, you have. We have the name is available. Spurti ji, aap usse you can just look into that. And next question we have from Dr. Archana again, and the question is about how indeficiency leads to yang deficiency.
Indeficient. See what happens, it's very simple. Indeficiency is nothing but the potential going down. If the oil in the flame is going down or getting depleted, how will the flame burn? It will eventually lead to yang deficiency, right? Same as when the flame, yang is excess, it will deplete the yin if it is not nourished or replenished. Same way, deficiency eventually leads to yang deficiency. Identify that, whether it is indeficiency primary or yang deficiency primary, based on full cold, empty cold, full heat, empty heat. And we need to take the history, see the tongue, see the pulse to identify its indeficiency or what it is, and then we can plan the treatment accordingly.
Thank you, sir. Sir, there is a question from Yogita Shukla ji. She has asked, please guide how can Indian BNYS graduates, sorry, sir. Please guide how
Approach
can
for
Indian BNYS
clinical
graduates can approach
naturopathy practice.
clinical naturopathy practice in abroad and what all is required to do the same? Mm,
Understand what is your curriculum, what all subjects you studied, how many hours have been dedicated by university and your college for each subject. So, and what is the depth of knowledge what you have, what is the internships what you have done, and you have published any studies, you have thesis presentation or case presentations. All this is required to show you as a professional, and the registration what you have from the governments in India. So when you present all these aspects and send a mail to them along with your curriculum, I think they should be able to understand that this is a genuine, they could recognize and guide accordingly. That's what I think for abroad practice. Now, I think Middle East, they've already recognized. Australia has recognized, but US has not yet recognized. Europe has not yet recognized. We have to do some post graduation and then get into it. But eventually it will happen. Now, World Naturopathic Federation is part of World Naturopathic Federation. Dr. Pradeep was there recently. Next year or next couple of years, naturopathic worldwide conference is supposed to be. We should plan it in India, I believe. So that way we can expand our horizon, and a lot of people can, get the things going. A lot of other countries will recognize our abilities, our curriculum, then we'll get the recognition.
Thank you so much, sir. Yoshita ji, so hope you could get your answer. In future, we'll be bringing the practitioners who from abroad for the workshops, so even you can get better insights from them also. So we'll try to get those practitioners who are already practicing in different parts of the world, so they can give you a better perspective how they are doing it. So we have another question. Can we treat cancer patients in?
Yes, absolutely we can treat, but only thing is the cancer site cannot be punctured.
Okay, sir.
There is one country in Israel, there is one institution called TCM Academy. Sorry. In TCM Academy, there are exclusive courses for acupuncture and cancer therapy. For all the adverse effects of cancer and chemotherapy and radiation, acupuncture can be a great tool to use. Just that be careful about the infection part and the site of cancer not to be punctured. So be careful, take the necessary precautions. You can definitely treat, and I have treated.
Thank you, sir. So Mahima ji, hope you got the answer to your question. And so we have one more question. Is Taiwan University good to study masters in acupuncture?
I think so because uh, I had gone through their curriculum once about the Taiwan University. It quite exhaustive, very good, and certainly try for it. Just look for whether their courses are recognized across the world. Just look for that. Then I think it should be good.
Okay. Thank you, sir.
You can send the curriculum to me, what Taiwan University has. Then I can look into it and tell how good it is.
Okay, so what you can do is, Thanuji, you can share the curriculum to us. If you don't have the number, I'll just type the number in the chat box. You can message to us, so I'll communicate with Dr. Gurudatta sir so that he can look into it. I have typed the number in the box. You can just connect through this number.
Yeah, you can also connect with me directly if you want to. I can type
Uh,
my number. I'll do
yes,
that.
yes, sir. If you can type your number so that people can directly connect to you.
Yeah.
Great. So, sir, we have a question. Can we treat peripheral neuropathy in acupuncture?
Absolutely. Absolutely. But we'll have to just identify, take a NCV, nerve conduction study done, and identify the cause of it. And be very upfront with your patient to what extent you can do. Don't give false promises, but you can definitely treat. In early conditions where you have pain, numbness sensation in diabetes, especially diabetic neuropathy, and how long, and whether you can reverse it or manage it. You need to be clear with your patient.
So, Pragadish ji, I hope you got answer to your question, or you can save sir's number and directly connect to him for further guidance. Okay, so we have another question from Dr. Pravesh Jain.
Okay.
He is asking, do we have any technique to diagnose which meridian chi is deficient or high, just by seeing the.
Uh, mm, Probably you'll have to do the inspection of the meridian. Uh, but just by seeing stagnation, you can. But deficiency or excess, it's not so easy. You'll have to use the tongue and the pulse diagnosis to make it happen. Otherwise, you'll have to understand the path of the meridian, view the meridian, and see if there are any physical changes. But at times, it is not very easy to understand and identify those changes along the meridian unless you palpate. But by seeing it may not be difficult, by palpating it is possible.
Thank you, sir. Dr. Pravesh, I would request you to connect with Dr. Gurudatta sir directly
I
on
hope
his
to have
mobile number.
answered it.
If you are sir for more guidance, you can connect with Dr. Gurudatta sir. Sir, we have another question. How about Zingwell Academy? Is it good?
Jingwell,
Yeah.
Jingwell Academy, I've heard about it, but I don't have much details about it. Where is it from? I'm not sure. Whether it is in India or outside India, I don't have much information about them. So I can't really comment on about that. Maybe I'll research a little bit and I'll let you guys know. You can message me directly. Is it Lena, right? Lena.
Yeah,
You
Leena
can
ji.
message me directly, Lena.
Yeah, we can directly connect with Dr. Gurudatta sir. Okay, perfect. So I think all the questions have been already taken. Before we just conclude the session with the vote of thanks, I would let you all know that we have an active Enigma directory, which is assess for which is for all the BNYS doctors. Those who have not enrolled into it, I'll just share my screen once so that you can have a look about it. And this is the Enigma directory. You can just type enigma.net to access this. It tells about the what is Enigma and all the members who are presently the office bearers presently in the Enigma. So you can have the look of all the faces over here. And at the same time, we have directory for the national level. So once you go into the directory, you can just filter by state or city or even by name. And if you want to get more details for that, you need password. And to get the password, you need to connect to us. Or you should be already in the directory, or you should connect to us. To connect to us, you can what you can do is you can directly connect to the number I have already shared, or you can WhatsApp from here. Directly, you can WhatsApp to us from here. So if you are not in the directory, as of now, more than 1,200 doctors have already registered in this directory. And at international level also, we have a lot of doctors who have already with us. You can select by the country they are, or even you can select by the name, so you'll get to know details about them. Apart from that, we have a list of some 30 colleges which are already there. You can get details of those colleges offering MD can be seen over here. If suppose you wish to pursue MD or something, if you are not in the directory, you can directly fill this form, so you will be listed into the directory. And of course, the event section, we have an upcoming event on naturopathy oncology, which is an offline and an online hybrid workshop. So if you are not into the directory, I request you should join the directory. Okay, before we conclude, we have a last question from Santosh ji asking that we have acupuncture study at Karnataka University. Do we have any acupuncture study at Karnataka University?
Uh, no, I don't think so, Santosh. We don't have anything as such for acupuncture in Karnataka University. Only university what we right now have is Rajiv Gandhi University of Health Sciences in Bangalore. And acupuncture is part of our curriculum in BNYS. As what is there, please let me know. But because we also need to understand what's the background, what is the process, who are eligible for getting into it, that we need to understand.
Okay. So, Spurti ji, now everything will be fine. There was some connection issue. Finally, let us conclude today's session. I thank you all for your active participation, energy, and openness, especially at the end of the workshop, asking all the questions. And you all made this workshop successful, meaningful, and inspiring. Apart from that, one thing I always learned that these interactive workshops helps us to get a better edge in our practice. And today we had such a special guest, esteemed guest speaker, Dr. H.K. Gurudatta sir. He was sharing his deep knowledge, clinical experience, and the powerful healing insights. I hope you all will apply these practices into your practice. And at the end, it is not beginning, but it is a good beginning for you to start with a healthier, happier you, as well as you can treat your patients properly. So keep connected with us. We have lots of workshop coming to us, and as suggested by Dr. Gurudatta sir, we will go ahead with a specific workshops on yin and yang and all the topics what he has already mentioned. So with his guidance, you can even learn those topics. So we are here to support your journey towards good health and for you to become an excellent naturopathy and yoga medical physician. Thank you once again. Wishing you great health and positive transformation ahead. Thank you so much.
Thank you, Dr. Vivek. It was such a pleasure for me and to share my knowledge and to see such a great audience with having so many questions. I was really happy about that. And at the same time, more than 1,000 registrations, which tells what we need. And more than 60 or 70 joined, I believe. For various reasons, others could not join. It's nice that we have a recording which would go along. Pardon me.
78 people plus people have joined, total overall.
Acha, acha. Oh, very nice. So very happy to know about that. I look forward to have more interaction with you guys in future. As we go along, we'll plan with Dr. Vivek. Thank you so much.
Thank you so much. So, dear friends, signing off for the day. And Santosh ji, your answer that there is presently no university in Karnataka who is offering these courses, as told by Dr. Gurudatta sir. So now you can just leave the session. The session is over for now. Thank you.